We are seeing a surge in new cases, which we anticipated a little bit after 4th of July weekend, but this is a much greater surge than we had ever seen before. We are having more new cases per day than we did last July. We haven't seen this many new cases per day since mid-February of 2021, before we had vaccine available to most people. And I think the most important thing to know about the Delta variant is twofold. One, it spreads remarkably quickly. Your viral load, the amount of virus that you have in your upper respiratory system with the Delta variant is literally more than 1,000 times higher than with the other variants. So it's no surprise that it spreads so quickly. And right now in South Carolina, about 68% of our new cases are Delta variant. What we've seen in other states is when, for example, Missouri, over 99% of their new cases are Delta variant. It spreads very quickly. And while the variant itself is not more lethal, if you just infect that many more people, you're going to have that many more hospitalizations and inevitably that many more people in the intensive care unit or dying from COVID-19. So it spreads more quickly. We've seen other states be overwhelmed, their hospital systems overwhelmed, their capacity overwhelmed, where emergency rooms are diverting patients to other hospitals. That's not happening here in South Carolina at this time, but I'm hearing from my clinical colleagues about, the intensive care unit being completely full, or for example, Children's Hospital here in Charleston, South Carolina. The Children's Hospital is the surge capacity for the adult intensive care units, meaning if they had run over, they had an overflow of cases in their adult patients, they were going to transfer them over to the Children's Hospital. Well, they can't. Children's Hospital is full. So we are rapidly approaching a really dangerous time where we do not have the capacity to take care of all these patients, in part because of the Delta variant, but also in part because I think a lot of people have just decided, oh, well, nothing much we can do. We don't have to wear a mask anymore. I'm just not going to worry about it. I'm going to put it out of my mind. And that's a serious mistake, to be complacent about the Delta variant. Vaccine is our way out of this pandemic. I mean, it won't happen tomorrow. If we vaccinated everybody this week in South Carolina, it would still be weeks before they had full immune protection from that vaccine. Vaccination is the way out of this pandemic. It is a race to get more people vaccinated. There's still some misunderstanding about what herd immunity means. Let me use the example of measles or mumps. These are two, people think of those as childhood illnesses because before there were vaccines, that's when kids usually got those illnesses. Now we have vaccines. Most of America gets vaccinated. And so you don't see outbreaks of measles or mumps very often. I think people don't understand quite how vaccines work. Vaccines don't create a magic bubble around you so that virus particles bounce off you. No, if you're fully vaccinated and you get exposed to COVID, you still breathe in those virus particles. You get temporarily infected. It's just that your immune system has had a sneak preview from the vaccine. Sneak preview, and right away your antibodies, your killer T cells, they're on the scene so that you don't get sick. But it can still be transmitted quickly from one person to another. So the key thing we need to do is to vaccinate as many people as possible so that we stop getting disease. So if we could reach herd immunity, what that will mean is that we will not have these outbreaks of people deathly ill, going to the intensive care unit, going, possibly to the morgue. Instead, we might still see little outbreaks of COVID-19, but I'm talking controlled situations, not what we're seeing right now with an out of control situation. Most scientific experts do not think that COVID-19 will go away completely, that we will worldwide eradicate or eliminate COVID-19. So that said, we have to think about what is the best case scenario with COVID-19. If we're saying it might continue to circulate, there is an end to the crisis that is going on right now. And the end to that crisis is immunity. And I think we are working towards it. I mean, we've actually had in the past month, we've had an uptick in the number of people who have been asking for a vaccine, who have come and gotten vaccinated compared to the previous month. There was big demand back in January and February when, we were short on supplies. And then starting in April, the demand started to go down. It's going back up. And I'm so glad to see that, because the way out of this, as I keep saying, is vaccination. We can reach herd immunity, but we still have a ways to go. What does it mean when we reach herd immunity? It means we get control of the crisis. We may still have some cases, but we get control of this crisis.